Welcome back. Thanks for tuning in. It's Dr. D with Salisbury Eye Care and Eyewear. Today we are going to talk a little bit more about LASIK because I'd like to give you an idea of what to expect if you're going to get refractive surgery. Alright, so if you're going to get refractive surgery, my first advice is to see your optometrist for an annual exam and make sure that your prescription is stable, that you're a good candidate for the surgery, and listen to their advice about a referral of a local LASIK or PRK surgeon. Your eye doctor is going to do a number of tests. Once you let them know that you are interested in doing LASIK, they're going to do a number of extra tests at your exam. What you can expect, many LASIK centers are going to have a complimentary sort of screening that you can do. So your optometrist might make the referral, let the LASIK center know that you're interested and they think that preliminarily you're a good candidate. And you go to the LASIK center and they're going to look at things and say, yes, let's proceed. Here's what to expect. Here's the pricing, and give you all of that information. After that occurs, there's a few things that you can expect to happen. You have to have an involved exam, almost like another comprehensive exam. Now, technically this can be done before your LASIK consultation. It's going to depend a little bit on the optometrist that you see. But in this exam, they're going to use special dilation drops that relax your focusing ability so that they can see whatever prescription you have there. Most likely, if you've been seeing your optometrist every year, they've got records, they know if your prescription's changing or not. They're looking for that stability. But before LASIK is done, it's really important to do what's called a cycloplegic refraction. Cycloplegia totally relaxes your focusing system so they can see all the prescription that might be present. As you can imagine, that's really important before you go get your prescription permanently fixed to know what really is there. Your optometrist is also going to do a few other things, including keratometry. Keratometry is a measurement of the curvature of the front of your eye. These are measurements that help your surgeon when calculating what to do for your prescription. Your optometrist will also measure the thickness of the front surface of your eye, the size of your pupils, and just check the health of your eyes in general. Once your optometrist has determined, yes, you're a good candidate, and sends on that data to your surgeon, the next thing you can expect is to have your surgery date scheduled. So when you show up for your LASIK surgery, it is an outpatient procedure, which means that you'll go in that day, have the surgery done, and be able to go straight home after you are released from recovery. Your surgeon will walk you through what to expect at the surgical center itself. We have found that most patients do really well with the surgery. They're going to apply a topical anesthetic throughout the procedure. Probably the most uncomfortable or weirdest part for people is that they do have to kind of secure your eye in place. Now, that's obviously for your benefit. They're trying to make sure that they, prevent you from looking around so that the surgery is applied to the right part of your eye. But that probably is the worst part, and it's not even that bad. They just simply use what's called a lid speculum to keep your lids open, and then there's another device they use to keep your eye looking straight ahead as it should. When the surgery is happening, you really just hear a series of beeps. Your surgeon will walk you through that. It's a little different at every surgery center. Once the surgery has been performed, it's pretty amazing. You can actually see clearly with both eyes pretty much right away. After LASIK, you can expect to go home on 3 different drops. All of our local surgeons in our area are using an antibiotic drop, a non-steroidal anti-inflammatory drop, as well as a steroid drop. You can expect that the antibiotic drop will likely be tapered off after about a week. The non-steroidal may be used for up to a month, and you'll do a longer, slow taper of the steroid drop itself. These are going to depend on the local surgeon that you use, so I would say always defer to your surgeon's instructions for post-op drops. Now, you will have a follow-up schedule, and what I do with my patients is refer them to a surgical center very close by. They're only having to go to that surgical center twice for a consultation and their actual surgery. After that, I'm going to handle all of their post-op care in my office. And so post-op care is done 1 day after the surgery, 1 week, 1 month, 3 months, and 6 months. If you're doing really well at 1 month, you may not have to see your surgeon till 6 months. This could vary a little bit. It may be that you're seen at a week and a month, but then not again until 6. Or you might be seen a week, a month, 3 months, and then just at your annual exam again. The final thing to expect with LASIK is that most surgical centers are going to have some sort of guarantee, which means that if you keep up with your eye exams, they will retouch your surgery at any time. So you will want to see your local optometrist every single year, make sure that your prescription is staying stable, and in the case that it's not, your surgical center will be able to decide if you're a good candidate for being retouched. I hope that helps. If you're considering LASIK, make sure to leave a comment for me below. I'd love to answer any further questions you have about the procedure or what to expect afterwards. As always, thanks for tuning in with us. We do have new videos coming every Wednesday at 4 o'clock, and we'd love to have you like us and subscribe. We'll see you next time.